When I grow up, I wanna be an old woman.
And we're back with our regular segment each Thursday from Kaiser Permanente. And joining us today, as you saw on the screen, Dr. Diana Coulson. Welcome to the program.
Thank you so much. Thanks for having me.
A little bit about your background, how long you've been working with this organization, and how you got involved in medicine.
I've been with Kaiser, let's see, for about 4 years now. I actually did some of my training with Kaiser out in Fontana. I spent 3 years during residency there, and I've been down at Mission Viejo for about a year now. You know, I always wanted to go into medicine ever since I was a child, and one of our close friends was a family physician, and I spent some time with him and saw what a difference he made in our community down in San Diego, and thought it would be a great career for myself.
Right. Well, you're the front line of medical care rather than the emergency room because you're in primary care. So you
Correct.
see little kids to us older folks and everybody in between, and do what you can for them. And sometimes you might have to say, go see somebody else, but you try and take care of most of the basic medical needs of your patients.
I try to.
Very good. Well, let's talk a little bit about something that affects a lot of people at this time of the year, and that's what we call the flu or influenza or other euphemistic terms that we might, the croup. I think I've heard people talk about the croup in the old days. Do we know what causes colds and flu?
Basically, colds and flu are caused by viruses. As far as the common cold, there's more than 100 different viruses that can cause the common cold. Influenza, there's fewer viruses that cause that. That's why we have a vaccination for influenza every year, and for the common cold, not so much.
Yeah.
They're not caused by bacteria, and that's really important because antibiotics do not help with colds and flu. Basically, they run their course, and we do our best to help with symptoms. Adults generally get about 2 to 4 colds or flus a year, and children more so, 6 to 8 or so.
Getting a cold versus getting the flu, are there long-term or life-threatening risks with either one?
There can be. The common cold generally is a milder illness. Usually starts with the scratchy sore throat and some fatigue and a mild fever, maybe 100 degrees or so. And the flu is more severe. Usually you get a lot of body aches, higher fever, comes on suddenly, hits hard. Patients often tell me that one day they were fine, the next day they woke up and they felt like they were hit by a truck. Viruses like those that cause the flu can cause pneumonias and that sort of thing. Viruses can set you up for a bacterial illness. If for some reason your immune system is down, over the age of 65, you're more at risk of developing, a bacterial illness if it's gone on for a long period
All right,
of time.
so somebody has got what they think is a bad cold or maybe the flu. They're really not sure. They come in to see you. First of all, how do you tell if it's just a cold or something more serious?
Basically, we go by history, so you'll tell us all those things that we just spoke about, the symptoms. And we go by vital signs. If you're having a real high fever, or we hear any wheezing, if you're having any shortness of breath, ear pain, anything like that may make us think that it's something a little bit more serious than just a common cold or a viral illness.
And then you say take 2 aspirin, drink lots of fluids, and rest. Sometimes doctors prescribe medication, but you said really there's not a lot of medication you can give for this, perhaps to relieve the symptoms, but really not to speed up the cure.
That's correct. Really the best thing you can do for these types of viral infections is to treat the symptoms. Plenty of rest, lots of fluids, You can use a humidifier if the congestion's really bothering you, saltwater gargles, that sort of thing. As far as medications, there's a ton of over-the-counter medications. Some which may be a little bit dangerous if you have any underlying medical conditions. So definitely, if you are thinking about starting anything over the counter, make sure you clear it with your doctor.
Call your doctor first, yeah.
Right.
Yeah. They're always saying they're looking for a cure for the common cold. I guess the person that does that gets a Nobel Prize. But basically, the fluids and the rest just gets it out of our system, and that's what really you're trying to do, is get those bad things out of our system.
That's right, and key to that is preventing the spread of the common cold. So if you have symptoms, make sure you're not sharing utensils, cups. Make sure you wash your hands, cover your mouth and nose when you're coughing or sneezing, and get your flu vaccine.
So flu shots and cleanliness, the two most important preventions there.
That's correct.
And there's no guarantee, I guess.
There's no guarantee.
Yeah.
Definitely if your symptoms have gone on for more than 10 days or you're having a real high fever, any shortness of breath or wheezing, go see your doctor.
All right, some good tips. Doctor, thank you so much for joining us. Good to have you on the program today. Dr. Diana Coulson, and she's a primary care doctor with the Mission Viejo Medical Office of Kaiser Permanente right here in our area. Thanks again for joining us on the program today.
Thank you.
We're all going to run out and wash our hands, get our flu shots, and hopefully all stay healthy during this time of the year. We'll be coming back with more as our program continues right here for you on Channel 6.
In my younger days, I made lots of mistakes. I hung out with the wrong people. Got into some bad habits. I neglected my relationships. The drinking was the worst. Now I'm older. I take better care of myself. Things are looking up.
Kaiser Permanente. Thrive.